have identified 644 new cases of COVID-19 in Alberta. There are now almost 8,000 active cases in the province. Currently, there are 192 people in hospital with COVID-19, including 39 in intensive care. As I've said, it is vital that we protect the health system. These numbers are concerning, and we are considering what further steps may be needed. We are confirming the exact figure, but about 13,000 tests were conducted yesterday, with a positivity rate of approximately 5%. Sadly, I must report that there have been 7 new deaths. I extend my deepest condolences to anyone who is grieving today. Each death is a loss for our community and a reminder of the importance of containing community transmission. We cannot simply dictate where and when this virus will spread. We all need to protect each other. Turning to schools, as of today, there are active alerts or outbreaks in 285 schools. That is about 12% of the schools in the province. Currently, these schools have 911 active cases in total. This number includes 57 schools that are currently on the watch list. So far, in-school transmission has likely occurred in 123 schools. Of these, about half have had only one new case occur as a result. I also want to let Albertans know that outbreaks have been declared at 2 sites supporting vulnerable peoples in Calgary. An outbreak has now been declared at the Calgary Drop-In Centre. There are currently 11 cases identified and widespread testing is underway. Outbreaks have also been declared at both Alpha House, where there are 2 cases, and one of their transitional housing units, where 5 cases have been identified. We are taking these outbreaks extremely seriously. Health screening of all staff and shelter clients is underway, and on-site testing is being conducted. AHS is working with various government and social agencies to support those who've been impacted. Remembrance Day is on Wednesday. I know this is an important and solemn time where we come together to honor sacrifice. While ceremonies and tributes will look different this year due to COVID-19, we can still commemorate this day while protecting one another. A number of annual large-scale events throughout the province have moved to a virtual format, and many legions will be holding smaller gatherings for their members. I encourage you to participate virtually if possible. For those organizing ceremonies or events this week, please respect gathering limits both indoor and outdoors. And remember, smaller is better right now. Organizers should consider ways to screen people who are attending to confirm they are not symptomatic or close contacts of a confirmed case. Most importantly, if any of us are feeling unwell, we need to stay home and recognize this day privately. I know this is a sacrifice, but it is an important one. It is also Diwali on Saturday. I know the Festival of Lights is a very special occasion for many Albertans. As with Remembrance Day, I am not asking you to stop celebrating this occasion, but it is essential that we consider COVID-19 while planning and attending any events. If you are in Edmonton or Calgary, please do not plan to host anyone at your home who does not live with you, and please do not attend a gathering at a home where you do not live. Outside the home, keep your gatherings as small as possible and no more than 15 in total when in any area of the province on enhanced precautions. Connect with others virtually whenever possible. Please wear a mask whenever you are in close contact with anyone not from your cohort, especially while you are indoors. And I need to stress that if you are sick with even mild symptoms, you need to stay home and attend virtually or celebrate in private. I, like many others, am extremely concerned by the spread that we are seeing. This weekend, we saw a daily record for new cases reported on Saturday, followed by high numbers on Sunday and today. Although the last few days have been a bit lower, we expect some variation from day to day, and we have not yet turned the corner that we must turn. Cases continue to rise, and if we do not bend the curve back soon, we may see further surgeries being postponed or other impacts on health services. It generally takes 1 to 2 weeks to see the impact of new measures like the ones that Alberta announced on Friday. However, the rate of increase and rising hospitalizations are extremely concerning to me. We are assessing measures closely. If needed, we do not need to wait 14 days before recommending additional measures. This is a critical juncture, and we need to get our cases down to below 100 new cases per day in our big cities with a growth rate, or R value, of less than 1. I think that the promise of vaccines is, of course, encouraging, and we are watching developments in different studies in the different types of vaccines around the world very closely. We're working with partners across the country, other provinces and territories, and the federal government to get vaccines when they are available. But what I would say to Albertans who may consider the possibility of a vaccine being available within a few months, perhaps as justification for not taking our current measures seriously, is that a few months within the life cycle of how COVID transmits can be a complete game changer. We have seen in the spring, we saw places like New York City and places like Italy really explode with cases in the matter of weeks. And so I think what I would say to Albertans is it is good news, and we are watching those vaccine developments closely. But a few months away is a bit of a lifetime away in terms of being able to change our behaviors right now. We're at a really critical time. We're going into colder weather, winter weather. We know that the virus transmits much more easily indoors than out. And we know that when people are spending time in those close quarters, we can see very quick spread. So now is not the time to ease off. And when that vaccine becomes available, it's likely only going to be available in small quantities, and we will have to make sure that we are prioritizing for those who are at highest risk when it first arrives. So we unfortunately do have to keep on holding on to our public health measures and looking for that vaccine is a good news story, but it's not here yet. And so in the short term, we need to protect each other with our actions until we have that vaccine in our hands.